Let's discuss the skeletal muscle of the arm, and compared to the fairly complex axioappendicular region, the arm is fairly simple. These are going to be muscles that are rope-like, very strong, and really play a role in terms of just a few actions. So I think this is going to be a little less complex than axioappendicular. So let's start with the biceps brachii, which is going to be the most superficial muscle of the anterior compartment. And this is considered a three-joint muscle. It's crossing the shoulder joint, the elbow joint, and the proximal radio-ulnar joint. So it can play a role in terms of all three, but really the main joint that it's going to play a role in is this elbow joint. So flexion of the elbow. Its proximal attachment is going to be the scapula, and as we recall, it's going to distally attach to the radial tuberosity of the radius. So all the way to the radius. We know that it can affect the proximal radio-ulnar because that's going to play a role in terms of pronation and supination. Any type of muscle that pronates or supinates has to attach to the radius. All the muscles of the anterior compartment of the arm are going to be innervated by the musculocutaneous nerve, so one of the 5 terminal branches of the brachial plexus. So this muscle, as well as the muscle deep to biceps brachii. We'll flex the forearm, supinate the forearm. Okay, so remember, this would be pronated, this is going to be supinated. And then the long head of the biceps brachii can also play a role in terms of flexion of the shoulder. So a fairly complex muscle when you think about flexing, this is the muscle most of us think of. But really the workhorse in terms of flexion of the forearm is going to be the brachialis muscle, which is deep to biceps brachii. You can see here that the tendons have been cut, and then you have this almost flat muscle deep to it, brachialis muscle. So from humerus to the coronoid process of the ulna. So since it's attaching to the ulna, it does not play a role in terms of pronation or supination, because remember, that's the stable bone for that. And like the biceps brachii, it's going to be innervated by musculocutaneous. So anterior compartment, musculocutaneous. When we move to the posterior compartment, this is going to be innervated by the radial nerve. And this is the first time that really comes up. But anytime you think of the posterior region of your upper limb, okay, so not only arm, but forearm, posterior equals radial nerve. So this will really help in terms of minimizing the things that you need to memorize. Almost all portions of the posterior compartments are going to be radial nerve. Now, as the name would suggest, there's going to be 3 heads to the triceps brachii. The more superficial ones are going to be the long head and the lateral head. And you cannot see the medial head unless you reflect one of the other more superficial heads out of the way in order to see the medial. These are going to attach from the scapula and humerus, depending on which head we're discussing, to the olecranon process of the ulna. And this is the main extensor of the forearm. If you think about extending your forearm, you can really feel your triceps brachii muscles. Depending on which particular muscle contracts, that differs depending on the specific action or specific force by which you're extending the forearm. So, these are it's not quite as complex as the axioappendicular. We're going to discuss the muscles of the forearm, of which there are quite a few. So we took a little bit of a break here. Let's move into the complexity of the forearm.